All right, good evening, everyone. My name is Ria Suarez with the Cancer Support Community, and I want to welcome you to our webinar, Frankly Speaking About Cancer, Coping with Fatigue. This webinar is hosted by the Cancer Support Community and sponsored by Amgen, Astellas, Lilly, and Tesaro. Before we start, I'd like to go over some reminders and a few housekeeping items. Today's event is being recorded and will be available on our website at cancersupportcommunity.org/webinars. For this webinar, our presenters will be featured first, and then we will begin the question and answer session at the end. For those of you who have joined us, you may submit a question through the Q&A box, which is found on the right of your screen at any time throughout the presentation. At the end of the webinar, you will be automatically redirected to our post-webinar survey. Please complete this survey as your input is of great value to us. This survey will only take a few minutes. So just wanted to give some background on the Cancer Support Community. We are an international nonprofit organization that provides social and emotional support to all people impacted by cancer. We have over 50 affiliates across the country, 100 satellite locations, and online programs as well. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. This slide just lists some of the resources that are available at the Cancer Support Community. We have our Cancer Experience Registry, our Open to Options program, and our Frankly Speaking About Cancer program. If you have any questions about any of these programs or would like to speak with one of our professional call counselors, please feel free to call our Cancer Support Helpline, which is listed at the top of the screen, at 888-793-9355. It is now my pleasure to introduce our featured speakers, Barbara Lubejko, Colleen Gill, and Laura Clausen. Barbara is an oncology clinical specialist in the education department at the Oncology Nursing Society. She has been an oncology nurse for over 30 years in clinical research and education roles. At ONS, she develops educational programs and clinical resources for nurses and has a particular interest in evaluating how these programs and resources can help oncology nurses provide the best care for their patients. Barb has also cared for several family members who have received treatment for cancer, including her mother, father, and sister. Colleen Gill is a registered dietitian-nutritionist, speaker, and author working with oncology patients since 1990 at the University of Colorado and since 2001 in her private practice, Nutrition Foundation. Colleen is active in the oncology practice group of the Academy of Nutrition and Dietetics. She helped write the first oncology certification exam for dietitians in 2008 and is herself a board-certified specialist in oncology. Laura Clausen is a certified surgical technician at Stanford Main Hospital. She found this job to be fascinating and rewarding and felt like she was making a difference. However, Laura has not been able to work since her diagnosis. She enjoys the outdoors, running, mountain biking, hiking, swimming, crewing, taiko drumming, and mahjong, to name a few. She is currently getting stronger and intends to pick up where she left off. Laura has 2 daughters and 2 grandsons. So at this time, I would like to turn the presentation over to Barb.
Thanks, Ria. Okay, it's the right slide. Well, welcome to everybody who's on the call, and I hope that the information that we provide to you today will be helpful as you deal with cancer-related issues yourself or for people that you care for. Fatigue is the most common side effect experienced by cancer survivors and can be experienced at numerous points along the disease course. It's been estimated that 25 to 99% of cancer survivors experience fatigue. This reported rate is related to many factors, such as how fatigue is defined, the type of cancer an individual has, and the type of treatment they receive. And for many cancer survivors, fatigue is rated as the most bothersome symptom they experience because of its impact on every part of their life. Cancer-related fatigue is different from normal tiredness, from too much activity, or from other illnesses. Cancer-related fatigue has been defined as feeling tired, exhausted, or worn out, often more intensely than ever before. And another distinguishing factor is that cancer-related fatigue is not relieved by rest and sleep. In fact, too much sleep or inactivity can make fatigue worse. In addition, fatigue can interfere with all aspects of a person's life, decreasing quality and interfering with the ability to engage in usual activities. And in addition, fatigue can occur alone, but is often part of a symptom cluster. That means it happens with other symptoms, most often depression, pain, and sleep disturbances. So overall, it can have a huge impact on people's ability to go about their normal activities. But the good news is that there are things you can do to help yourself deal with and decrease fatigue, and we'll get to those in just a few minutes. So fatigue occurs for a number of different reasons in people with cancer. And this can be at any point along the line from diagnosis through end of life. One of the big impacts that causes fatigue is just the effect of the cancer on the body. And this is really because the cancer really stresses your body, and because your body's having to fight so hard to overcome the cancer and to deal with the treatments, so that you can just become very worn down and tired, and it can even increase your metabolic needs, contributing to fatigue. In fact, one of the more common presenting signs of cancer is fatigue. So people often start out with fatigue even before they're diagnosed. And then with the treatments and the other things that can accompany fatigue, it just becomes more severe. And the other thing about fatigue is that while it can happen at any point along the disease course, people with more advanced disease do tend to have more fatigue than those in early stage. And the good news is that as the disease goes away, as the cancer goes into remission, fatigue does tend to stop. Pretty much every kind of treatment for cancer will cause fatigue, and I will talk about the different types of treatments and how they can affect the body and cause fatigue in just a couple minutes as well. Also, people often have concurrent symptoms that can contribute to the fatigue, things like nausea and vomiting, and just the alterations to the body chemistry that can happen with that can increase fatigue. Pain often will contribute to fatigue, and shortness of breath can also have a big impact on fatigue. Anemia is another reason for fatigue, and anemia is a low red blood cell count. And as many of you may know, that the red blood cells are what carries oxygen throughout our bodies. So if you don't have enough red blood cells, parts of your body may not be getting enough oxygen, and that can often make you feel tired. Nutritional deficits can contribute as well, and Colleen will be addressing those in a little bit. Sleep difficulties can also contribute, and even though sleep may not really get rid of cancer-related fatigue, it still is essential. And in particular, people with cancer and getting treated for cancer may have trouble getting a good night's sleep, and that can further contribute to the fatigue. Infection can also contribute to fatigue because of the extra stress on the body, and then depression and anxiety. And I'll talk about those a little bit more in a few minutes, because depression and anxiety and fatigue often go hand in hand, and sometimes it's hard to tell exactly what's came first, the chicken or the egg. But it's also important to note that not everybody who has cancer undergoes treatment for cancer will experience fatigue. But the more of these factors that a survivor has, the more likely they are to experience significant fatigue. There are other conditions that can also contribute to fatigue. Some of these things may include diabetes and heart or lung disease, thyroid disease, in particular hypothyroidism, menopause, kidney or liver disease, autoimmune diseases can contribute, and medication. And in particular with medications, things like pain medications. Not only can pain make you fatigued, but then the medications, as many of you probably know, can also make you pretty sleepy and hard to be able to do your normal activities. Sleep medications, especially if they are the kinds that tend to have an effect that carries on to the next day, Anxiety medications can also make you sleepy as well as antihistamines. So if you are having fatigue and are taking some of these medications, it would be worth your while to speak to your healthcare provider about it to see if anything can be done to kind of change things up so you're not having as much fatigue. In terms of when cancer-related fatigue can happen, it can happen really at any point during the disease continuum. And as we talked about, it's a common presenting factor, but it can continue to kind of go up and down throughout the course of the disease. The thing about cancer-related treatment is that pretty much any kind of cancer-related treatment can contribute to fatigue, but they all affect the body and lead to fatigue in a different kind of way. Surgery, even though surgery is not something that a lot of people think of as contributing to cancer-related fatigue, can absolutely cause fatigue for people. Anybody who's had surgery knows that even just post-anesthesia can cause you to be tired, but also there is the whole recovery period. So people who've had surgery can feel more tired for days to weeks, depending upon the type of surgery and the extent of their surgery. Pain and pain medications, again, can contribute stress on the body from healing, especially if you end up with an infection, and also decreased appetite and fluid intake can impact that, as well as inactivity. Typically, though, with surgery is once you recover from the surgery, the fatigue goes away. Chemotherapy can affect people in terms of causing fatigue in many ways as well. For people who receive intravenous chemotherapy, the worst fatigue usually occurs 2 to 3 days after they receive the IV treatment and then tends to gradually dissipate until they get to their next treatment, unless their blood counts drop. But we'll talk about that in just a minute. People receiving oral chemotherapy or chemotherapy by mouth, the fatigue tends to come on more gradually and may continue as long as they're taking the medication. Although with some of these chemotherapy medications, the fatigue may be worse and then subside a little bit as you get more used to the effect on your body. The severity of fatigue with chemotherapy varies greatly between people, with some people having very little fatigue and some people having very severe fatigue. But the fatigue will gradually resolve after chemotherapy is complete. For biotherapy, fatigue is one of the most common side effects of biotherapy, especially some of the older biotherapy agents like interferon and interleukin. They actually had as one of their limiting side effects fatigue. With some of the newer, more targeted therapies, we're not seeing as much fatigue, but they certainly can cause fatigue, especially when people take them over a long period of time. And again, once the treatment is done, the symptoms from the fatigue from the targeted therapies will go away. Radiation therapy has a very strong connection with fatigue, and almost everybody who has radiation therapy will end up with some degree of fatigue. And what tends to happen with especially the external beam radiation, where you go in and have your treatment in a machine on a daily basis, is that for the first week or so, people will actually feel pretty good, but then the fatigue really starts to set in. And pretty much what will happen is that people will gradually get more and more fatigued through the course of their treatment, so that by the end of treatment is when people tend to be the most worn out and have the most severe fatigue. That will start to get better as the radiation therapy is over, but it can continue on for a little while. And with any treatment for cancer, the fatigue usually will start to lift pretty quickly after treatment is over, but for some people it can linger for a long time. And it take quite a while before people recover more to their normal function from where they were before. So in terms of what cancer-related fatigue feels like, fatigue feels differently to everybody, but some of the most common terms that people use to describe it include weakness and limb heaviness. You know, that feeling when you just are having trouble getting up and getting moving. When people feel more tired than would be expected by the amount of activity, and it could be that you're used to going out and taking a half an hour walk, but you walk for 5 minutes and you just can't do it anymore. Or you go to the grocery store and have to stop and sit for a few minutes and take a break. That is pretty indicative of cancer-related fatigue. Also, for people who do engage in physical activity, sometimes the fatigue can last for several hours. My sister, for instance, had a lot of fatigue, and she would go and take a walk, but then she'd have to come home and lay down for 2 hours. So sometimes it takes longer to recover with cancer-related fatigue from physical exertion than normally would happen. Another thing that can happen is decreased concentration, or attention, and this is something called attentional fatigue. And this may just be that you have trouble focusing on a book or a newspaper to read. People will complain that they just don't have the attention span that they used to. And this can obviously impact many parts of your life, including work or leisure activities. People complain of short-term memory problems. Sometimes people feel like they have to keep a schedule where they might not have been able to, they had to do before, so they can make sure that they are keeping track of everything and keeping up on their medications and their normal activities. People may have difficulty sleeping or may sleep too much when they're fatigued. And the other thing is that even people who sleep more find that the rest in the sleep is not really refreshing or restorative. So they're just not recovering like they normally would. Also, people may feel a lack of interest and difficulty completing their usual activities. So preparing meals, going to work, social activities may be harder to accomplish or may just not be something that they really even have the desire to get involved in. And finally, people find that they can feel very sad, frustrated, and irritable by the feelings of fatigue because they just can't do the things they used to and they just aren't feeling the way that they feel like they should. So in terms of describing fatigue, one of the things that I really encourage people with fatigue to do is to keep track of just exactly how they feel when they're feeling fatigued. There are many different ways to measure fatigue, and one of the most common ways is using a scale like this, where 0 is no fatigue and 10 is the worst fatigue that you've ever felt. And sometimes this can be very helpful, especially over time, in reporting to your healthcare team just how fatigued that you're feeling and how this compares on a day-to-day basis. Other scales are available as well, but they're more complicated. And the important thing is just to be able to describe the effect of fatigue on your life, what makes it worse and what makes it better. So when meeting with your healthcare provider, you want to be as descriptive as possible. Give detail about the physical symptoms and how you feel emotionally. Compare your symptoms to how you usually feel. Be very descriptive. Use terms like, I've never been this tired before. I feel like I can't concentrate enough to read a book. I wake up feeling as tired as I did before I went to sleep, no matter how long I sleep. Or even I feel so frustrated that I can't make myself get up off the couch. Any of those things are very helpful to kind of quantify and even monitor fatigue over time so the healthcare provider knows what they need to do to help you feel better. And the thing about fatigue is it's very personal. It's the same thing with pain. Is you are the only one that really knows how you feel. There are no tests to determine how fatigued you are. So by sharing the details, you can really help work with your healthcare provider to set goals and to look at ways that you can improve. So one of the nice things, well, I don't know that nice is the right word for it, but one of the things about fatigue that I think is encouraging is there are many things that you can do to help fight your fatigue. And while there are not many medical ways to manage fatigue, there are lots of other ways, that lifestyle changes that you can do that can help decrease or even prevent fatigue if started early enough. And these include things like physical activity, restorative sleep, diets and supplements, stress reduction, balancing activity and rest, attention restoring activities, medications, and correction of anemia. And we'll talk about each one of these individually. So really the big intervention, the best thing you can do to help fight fatigue is get involved in physical activity. And I honestly use the term physical activity as opposed to exercise. It's just my bias. But I feel like people hear exercise and they feel like it has to be this structured thing they do. Physical activity is as simple as just getting up and getting moving. It certainly can be something more organized, but the bottom line is you just really want to get up and get moving and reduce the amount of time that you're sitting around not doing anything. And that can be a very challenging thing to do. But many, many research studies have shown that different types of physical activity can reduce fatigue and related symptoms, and if started early on in treatment, may actually even prevent some of the fatigue that can happen. And physical activity obviously has lots of different benefits that can help improve quality of life. It can help manage anxiety and depression. It can improve cognitive impairment being difficulty focusing and memory issues. And it can help people be able to focus a little bit more. It can improve your sleep quality. It can help maintain your bone strength. For people who have lymphedema, it can help manage that. And with lymphedema, sometimes that extra weight that might be carried in the limb can make it more difficult to be physically active and contribute to fatigue. And it may actually decrease mortality. In some populations, there is data that shows that, in particular, women with breast cancer, anybody with colon cancer, there's some beginning data in prostate cancer that being physically active may help decrease recurrence and mortality from the disease. And the bottom line really is that physical activity can often help cancer survivors feel better more quickly and really speed recovery from treatment. So in terms of physical activity, there are some different types of physical activity that you will want to consider because they all contribute to managing fatigue and overall health in a different way. Obviously, aerobic activity is important, and the main benefit of aerobic activity is improving your heart and lung functions. And what that does is it improves the availability and also your body's ability to use oxygen, and that in itself will be regenerative and also to help improve your fatigue. Resistance activities like weightlifting or using your body's weight to build muscles, and whether that's, it could be push-ups, it could be squats or lunges, it could be all different kinds of strength-building activities can help increase your muscle mass and strength. And this can also help improve your balance and endurance, which can also guard against fatigue and also prevent injury so that you can continue to be physically active. And then flexibility activities such as stretching and yoga are also useful as they can help prevent injury, improve joint movement and coordination. Stretching activities can help decrease muscle and joint stiffness and soreness, all of which can improve your tolerance of aerobic activities and then, again, increase your fatigue level, or decrease your fatigue level and improve your energy. And many of these types of physical activity can also help to improve your mood, which can in turn help manage the fatigue. In terms of how much physical activity, there are many of the same recommendations go for cancer survivors as the general population. So there are a lot of organizations that have come out with recommendations for how much exercise everybody should be getting. And this is primarily for healthy people, but anyone who wants to work toward that level of health. For the general population, the recommendation is at least 150 minutes each week of moderate intensity or 75 minutes of vigorous intensity activity, and that should be divided over several days of the week. They usually recommend 3 to 5 days. And there also people should engage in at least 2 sessions per week of resistance training, and that includes things like stretching as well, and that's to build up that muscle mass. And by doing that, you also increase your metabolic rate and it also helps with weight control. So for people with cancer survivors, and this actually should be cancer survivor recommendations as opposed to post-treatment recommendations, because people can engage in physical activity at any point in their disease trajectory. So for cancer survivors, the goal is the same, but the goal should be something that you're trying to achieve as opposed to something that you should be starting to do right away, because you really want to adapt your level of physical activity to what your current physical fitness level is and your age and other risk factors. You want to start, if you're not currently involved in physical activity, you want to start with light activity and then gradually build up. And if you have any cancer or treatment-related symptoms, you want to talk to your healthcare provider before beginning any physical activities. So kind of in terms of starting with light activity and gradually building up, work with a lot of people who currently are not engaged in any physical activity at all, and what we'll typically tell them is start slow, start by trying to walk for 10 minutes down the block or, walk out to the mailbox and back each day. And then once you feel like you're doing that well and are building up your strength, then you can extend that so that you're getting to the point that you're engaged in physical activity, whether it's walking or riding a bike or whatever you enjoy, going on the treadmill for an average of 30 minutes 5 times a week, but that is the ultimate goal as to where most people should be starting from. And one other caveat I do want to put in here, we'll talk about more in just a minute, is before you begin any physical activity, either starting new physical activity or increasing your current level of physical activity, you do want to talk to your healthcare team, whether that's your doctor or your nurse or your physical therapist if you have access to one. So there are a number of reasons why people absolutely want to talk to their healthcare team before they begin physical activity, because these are some risk factors for injury if someone begins engaging in physical activity. So some reasons for extra caution include currently receiving cancer treatment of any kind, including hormone therapy, because hormone therapy can have effect on your bones. So you do want to talk to your healthcare provider if you're currently undergoing treatment, even though most people undergoing treatment can engage in physical activity. If you have any muscle or joint issues, including things like osteoporosis or bone loss, a history of fractures, if you have metastasis to the bone or something like arthritis, you want to make sure that you're evaluated before you engage in too much physical activity. If you have a history of falling or unsteadiness on your feet, you want to make sure that you're evaluated first. Peripheral neuropathy, if you're not familiar with that, that's numbness and tingling in your fingers and toes. In particular, if you have numbness in your feet, that can make your risk of falling higher. So you want to make sure that that's evaluated before you engage in physical activity. And also part of this is not that you wouldn't be able to engage in physical activity for these things, but you might need some different adaptations. Lymphedema is another reason you would want to be evaluated first. Heart or lung disease, either separate from your cancer or maybe damage from treatment if you've had radiation to the chest or you've had chemotherapy that can affect the heart or the lungs. You want to make sure that you're evaluated for your ability to engage in physical activity. Then if you have, like venous access devices or ostomies, again, these are not things that typically mean you can't be involved in physical activity, but you may need to do something a little bit different. And just a big, kind of an additional point here is that almost every cancer survivor can be involved in physical activity of one sort or another, and most cancer survivors can be involved really in any sort of physical activity, but you just want to make sure that you have the support of your healthcare team first. So in terms of avoiding potential risks of physical activity, again, we already talked about talking to your healthcare team. Other reasons reasons you absolutely do not want to engage in physical activity is if you have severe anemia. That clearly needs to be treated first because that can really stress your heart and lungs. Any changes in your physical condition, if you have any new symptoms or any change in symptoms, worsening of any current symptoms, you definitely want to talk to your healthcare team before you either begin to or continue to engage in physical activity. And then if you have an active infection, you should take a little time off. And again, just keeping an eye on how you're feeling. If you're out and you're getting, you're walking, you're riding a bike or doing Tai Chi or whatever you enjoy doing, and you start to feel bad, you start to feel dizzy or short of breath or have pain, obviously, or just the thing to do is not to push yourself. And I think that many people think they should push themselves and get past that, but you really don't want to do that. You want to stop and kind of evaluate how you're feeling and give yourself a break. So the caveat typically is to start low and go slow and then gradually build your way up. And for most people, that works really well. If you do have some limitations or would like to, working with a fitness professional, a physical therapist, or a trainer who has background in working with people who have limitations because of cancer or other diseases can really be a good way to go as well. So sleep. Sleep is also really important, obviously, but the thing is, with sleep for fatigue, while it may seem counterintuitive, it is important to rest, but too much rest can actually make your fatigue worse, which is why we talk about physical activity first. So for sleep, what your focus should be on is setting up routines that can help you get a good night's sleep to help restore your energy level and help your body to heal. Some steps you can take to help you sleep include things like avoiding long naps during the day. If you do feel the need for a nap, try and limit it to 30 to 45 minutes and try not to make it too close to bedtime. Avoid caffeine in the evening. Go to bed at the same time every day if you can. Actually, go to bed and get up at the same time every day as much as possible. And then adopt a bedtime routine. Do something that you find relaxing. And usually this goes with the recommendation of relaxing for an hour before going to bed. Whatever it is that you enjoy doing, it could be listening to music, it could be reading a book, taking a warm bath or shower. In terms of music, there actually is research that shows that listening to music, for especially classical music, but music that's soothing for half an hour before you try and go to sleep, can actually help improve people's ability to go to sleep and also to be able to go into a deep sleep. Recommendation is to not watch television or use a computer screen in your bedroom, and not to use it right before you go to bed, because the light from the screens can stimulate your brain and make it more difficult to go to sleep. And also sleep experts say to reserve the bed in the bedroom for sleep and sex, so that your mind really associates your bed with relaxation. And then maintain a comfortable sleep environment. For the most part, that means a cool room with light covers. A fan can help. Sometimes that white noise can help as well. As dark as you like it to be and quiet. So just setting a really good space for you to be able to relax and go to sleep. A note on emotional distress. Emotional distress is such a common issue for people, for cancer survivors anywhere in terms of kind of the course of their disease. It's very common to experience anxiety or depression. And as this often occurs along with fatigue, they can not only contribute to each other, but can actually be very difficult to tease out what's fatigue, what's depression in particular, and anxiety feeding in there as well. And sometimes severe fatigue can mask emotional distress. So if you have severe fatigue or someone you care about has severe fatigue, it's important to have them evaluated and to see if they may have depression, because it's not unusual for people to feel very tired when they're depressed as well. So it may be that the anxiety and depression need to be treated, and that can also help manage the fatigue. And then in addition to that, taking steps to reduce stress can also decrease fatigue. So for stress reduction, there are a lot of other options as well. Obviously, physical activity can help, but there are lots of other ways to reduce stress. Things like therapeutic massage. There are therapeutic massage therapists. Sorry about that. That's the word. Therapeutic massage therapists who specialize working with people who are cancer survivors. Yoga can be helpful, and especially yoga that focuses on breathing and stretching. Meditation, such as mindfulness-based stress reduction, can help to kind of calm your mind and decrease anxiety. And there is some evidence that complementary therapies such as acupuncture, guided imagery, expressive writing, Reiki, or therapeutic touch may help reduce stress. The whole thing is to find what you enjoy and what appeals to you and see how that can help you reduce your stress. Support groups. Also need to put a plug in for support groups, because they can be very helpful and are available through many community support organizations and healthcare institutions. And for those of you who have been part of support groups, know that they can provide a great support environment where you find other people who feel similar to you and feel like you're not alone, and then also can share ideas about ways that you can reduce your stress as well and cope better with what's going on. For some people, it's important to meet with a psychosocial professional, like a social worker, a psychologist, psychiatrist, psychiatric liaison nurse. There are a lot of different people out there who can help in coping. And if you think you would like to talk with someone on an individual basis, checking with your healthcare team about who's available in your community can help. And finally, medical management. And I left this last on purpose because there really aren't a lot of medical interventions for managing fatigue. Most of these are reserved for specific situations or fatigue that has not responded to other interventions. The first one is correction of anemia. And for fatigue related to severe anemia, blood transfusions can be helpful, but indicated for most cancer and do not always have a significant impact. For more long-term anemia, because of treatment, their erythropoiesis stimulating agents, things like Procrit, Epogen, and Aranesp may be indicated, but again, they're used very selectively because they do have risks. In terms of medications, modafinil, which is also called Provigil, has been tried, a little bit of evidence to say it might help. This is a drug that's used to promote wakefulness and is used for things like narcolepsy and excessive daytime sleepiness. There is some evidence that it might be effective, but again, all these drugs have side effects, so you want to make sure that they're used carefully. Antidepressants, it's not clear whether they help or not, but if someone's got depression or anti-anxiety drugs to help manage anxiety may help relieve some fatigue because of the help with the other symptoms. And then nutritional supplements and herbal therapies, Colleen's going to address. But the bottom line is they all should be used under the recommendation of your healthcare provider, as they all can cause potential side effects, but are things that may be worth pursuing. Very quickly, I wanted to just do a quick case with you. This is a patient that was a 57-year-old male with stage 3B colon cancer, and he had his tumor resected 2 months ago and began chemotherapy with FOLFOX 4 weeks ago, and is having a lot of side effects in terms of nausea and vomiting and overall fatigue. And the nausea and vomiting are managed, but this gentleman is finding that nothing is relieving his fatigue, and he rests or naps during the day most days. Some days he naps so much he has trouble sleeping at night. The changes in his energy level and sleep patterns are making him miserable. He's just really struggling. But he's not exercising beyond walking slowly around the house or between the car and the clinic, but he has no issues with walking or reasons to restrict his physical activity, but has never really heard what he could do to manage his fatigue. So Mr. James and his nurse mutually set a goal to walk for 10 minutes 3 times a week for the next 2 weeks. So starting out slowly, and then we'll build up from there. He's instructed to use caution and to let the staff know if he has any problems. And then he finds that the walking is helping him to have less fatigue, and he gradually works over time until he's able to meet his exercise goals. So physical activity can have a real big impact on fatigue. So now I'm going to turn things over to Colleen, and then I'm happy to answer questions later.
Oh, I wanted to, thank you, Barbara. I wanted to kind of bridge the case study that was given for Mr. James and start to think about some of the things that we might want to ask about how he's eating and drinking and doing some other things that might be affecting his fatigue as we go through this. And I think it's a good example of how our usual initial thoughts about how to handle fatigue aren't necessarily all that helpful, like sleeping more and thinking that exercise would only tire us more, when actually it's quite helpful for people to do that. So I spend a lot of time talking to patients about fatigue, in part because I think most patients consider it part of the package and they're not aware of things that they might be able to do and to help themselves. And I think it's worth having that discussion with them at that point, because it certainly can get in the way of their eating well, everything from affecting their appetite, their desire to eat, to their ability to prepare their meals and be able to eat because of that. So I'm going to be talking about, I'm going to be talking about several different things. Today we'll talk a little bit about anemia. I think that's the first thing most people think about, that must be the source of their issues, especially as they notice their hematocrit dropping a little bit because of some of the side effects of the chemotherapy. But as we'll see, that's usually not the primary intervention or the one that's going to be the most successful. What I have found is that hydration, exercise, as Barb already talked about, but making sure they're hydrated and making sure that they're eating smaller, more frequent meals to avoid rapid weight loss and roller coaster kind of blood sugars can really be the most useful interventions for them. And doing things to help them realize that they need to conserve their energy, that they no longer have to try to do everything as if they're not undergoing some pretty significant treatment that is responsible for a lot of the fatigue that they're feeling. and I'll end up with some integrative therapies that have some research about them and that may well be useful for people as well. When we look, I already went too far. Technology is not my friend here, sorry. A lot of times people will say, I'm anemic, I must need iron. I think it's from watching all the Geritol commercials when we were growing up. But in fact, most low hematocrit levels are due to the impact of chemotherapy on the bone marrow and the bone marrow's ability to make those new cells. It's not because of any lack of nutrients. Often you may have all the iron reserves in the world, but the bone marrow can't put it together to make those cells. And throwing more of those nutrients at it is not going to solve the problem and can contribute to some other issues. Excess iron, for instance, can create more free radicals. So we're generally trying not to give people iron unless we can actually prove that they're iron deficient, that we check things like ferritin and total iron binding capacity and something beyond a hematocrit. But there are certainly nutrients that are important for for having that those building blocks for treatment and making your blood cells. And you need to have enough folate. You need to have enough B12 coming into your diet. And that would just mean a well-rounded diet in general is going to be the thing that we're looking at. Green leafy vegetables, dried beans, the whole grains, orange juice are all good folate acid sources. And B12 comes with most of the proteins in our diet. So those are things that you would want to be including and making sure your diet isn't getting skewed to eliminating whole categories of foods. That will be a pretty important part of analyzing whether this is an issue for you. If you are documented with an iron deficiency, then we look at what kind of iron treatments can we give you, what is going to be best tolerated by you. And iron comes in a couple of forms. The iron that we get from animal-based foods, especially liver is the best source, red meat's second, and then your poultry and chicken and fish. Those are irons that are bound to heme, we call it, or blood or protein, that ends up with it being 35% absorbed. So those are absorbed about 10 times better or more than iron that comes from plant-based foods. That's what you get in cereals and greens and beans and soy, all of those things. It's also the kind of iron that's in something like ferrous sulfate. If you are taking that kind of iron, whether it's by choice because of vegetarian preferences or it's what you've had access to, we know that several things will affect how well you absorb that iron. And so we look at increasing that absorption with vitamin C as you take that iron pill or as you eat that iron source, so that you take it with some orange juice or broccoli, tomatoes, spinach, things that have vitamin C in it. It keeps the iron in a form that's a charge that is better absorbed. We also know that cooking in cast iron skillets actually does release some iron from the skillets and increase the iron content in foods. What a lot of people don't realize is that tea, well, it's considered a very healthy thing for many cancer patients. If you're taking your iron supplement with tea, you're blocking the absorption of that iron. You're keeping it in a charge that isn't as well absorbed. The same with taking it with antacids or calcium supplements at the same time. So separating those out may make you respond much better to your iron supplement going forward and help you replete that. More importantly, as I mentioned, is I think dehydration aggravating fatigue. And in general, I find people fall into a couple categories. They're either drinkers or not drinkers. Historically, many people walked around sort of marginally dehydrated and never got quite enough fluid. And so that is now aggravated by the other problems they're having. They're drinking a little less. And they can actually see weight changes. This is worded a little differently. They're seeing weight changes that can occur that aren't a true weight change, but are actually just a drop in fluid. Every quart or liter of fluid weighs about 2.2 pounds. So anytime you see your weight drop rapidly, it's almost inevitably a hydration change for you. Same if you suddenly start retaining fluid and your weight goes up rapidly. It's the weight of that edema that's causing that weight change. But when we see that weight falling due to dehydration, we often also see people with headaches, more nausea, a lot more fatigue. I always say, think of yourself as that plant outside the sprinkler zone, and that they're wilting. And if we water them, they perk back up. We see people who come into our infusion center, and by giving them IV fluids, the color comes back into their cheeks. They feel like they have a lot more energy. It makes an immense difference for them. Otherwise, I just think of them as wilting as well, and affecting both their energy level and their even muscle weakness. The other signs you're going to see is darker urine color as your kidney tries to concentrate things and save the fluid, keep you hydrated. It'll be lower volumes and just darker in color, and it starts turning kind of amber, brownish. That's when we know we're really in trouble. That fluorescent yellow you might see can just be from a multivitamin. The riboflavin tends to make that fluorescent yellow color for you. Constipation happens because the colon's job is also to keep you hydrated and suck the water back out from the stool so that you can stay hydrated. So not having enough fluid there is setting up competition with who gets to keep the water. So very much in your best interest to just try and make sure you're getting in enough fluid so that you don't have the issues with headache and increased nausea and pain. Another thing that can happen is actually dizziness. When you move from sitting to standing, you have trouble maintaining your blood pressure, and you will be obviously less inclined to want to go exercise or walk outside because it'll be a little scary to you. So staying hydrated can help you maintain your goals of exercising as well. I think that many of us assume that we will be thirsty when we need more fluid. And unfortunately, that's much less of a reliable sign as we get older. It's not going to cue you into when you need more fluid. So don't rely on that to indicate that it's time to go get something to drink. I recommend that you aim for about a quart, 32 ounces by noon, and another by 6 p.m. And the reason we go for that is we want you to have most of your fluid in by that time so that you're not pushing it all at night and then you're disrupting your sleep by getting up to the bathroom all night long. It's not that much. If you look at it, it's a couple of those 16-ounce bottles of water that you might see, and it can be any fluid. There's no it has to be water type of rule here. In fact, we encourage you to mix it up and pace it so that you don't burn out on one thing, so that you can have a variety of things going on. And if you don't like to drink all your fluids, you can eat solid fluids like Jello and popsicles and watermelon that are really largely fluid once they get into you. So that can be something to help you as well. I often find when patients are tired, they're watching more television than they've ever watched in their lives. And if they try to tie this new habit of drinking more with the television, every time there's a commercial that comes on, they should just pick it up, drink an ounce or two, put it down. Certainly by the time the program's over, you're going to have gotten down that bottle of water. And that will help you not concentrate on how hard it is to do. There's a couple of free apps, Waterlogged and Drink Water Reminder, that might be helpful for you. Whatever is best for you. I know that there's this thought that it has to be all non-caffeinated, and certainly that's better because caffeine can interfere with your sleep, and that'll rebound on you. But you can have some degree of caffeine. We just encourage it earlier in the day so it doesn't interfere with your sleep later. And remember that, fluids are also involved in clearing toxins and waste from your body. So if we aren't doing that effectively, then we're probably not going to be, doing as well with other things that might be causing us fatigue too. When I see rapid weight loss in patients, real weight loss, we know that they are losing muscle along with it. Their bodies are assuming there must be a famine happening, and they're burning everything as calories. And when they need protein, they're ending up going to their muscle. So that's going to affect your ability to do the things that give your life meaning and what you like to do. So I always encourage them to look at their schedule, set up, excuse me, my voice is leaving, set up a schedule by setting cell phone timers that will remind you that it's time to eat, so you have the opportunity to eat that small amount of food that you can eat at that point. I also think that having a list of ideas of things you're tolerating, and usually those are things that are softer and moister and may even be fluids that have calories in them, is really going to be helpful for you. That way you're not trying to come up with the list every time, you're just editing that list, and it makes sure there's some variety there, that you don't burn out on doing the same thing over and over again, and that you can be reminded of extras if you need them, like adding cheese to the eggs if you need those calories. And when you go to the grocery store, you already have your list, and that is helpful as well. We use more of the plus version of some of those drinks for the extra protein and the extra calories, but we also include a lot of the clear liquid versions of some of the supplements. The brand names would be Boost Breeze or Ensure Active protein drink. There's drinks in the vegetable section of the grocery store, Odwalla, Naked Juice, Bolthouse Farms, but I always look for the ones that protein is in the label so that we're including that, and I'll show you why that is in a minute. And other people may just prefer to use the powders that they can add to milk. They feel like they like that better. What we teach patients is that keeping blood sugars stable keeps your energy level more stable. If you have low blood sugars, you have less energy available to your cells, and you're going to be tired. By eating every 3 hours, we stabilize those blood sugars. We keep them on a kind of even keel. And that especially occurs if we mix carbohydrates with protein. About 20% of the protein ends up converting over to carbohydrate over about 2 hours. And so as you're coming down from the high of the blood sugar, it kicks in and keeps you from dropping too low or becoming hypoglycemic. And that can be very helpful for people aside from the fact that we would like them to get the protein in that they need anyway. It's just helpful for blood sugar control and stability. I use the plate model in almost all of the lectures I give about long-term goals around what should be covering your plate for optimal health and post-cancer and cancer treatment recovery, which would be that half of your plate would be covered with vegetables, maybe one piece of fruit that's about a fist-sized piece, and then the other half divided between your carbohydrate and your protein sources there. And what we find is that whole mix works together. By having those amounts of those different foods, we end up avoiding what we call naked carbohydrates, where the carbs alone hit your stomach, and your stomach's job is to sort of pace how things empty, and it says, oh, these are really easy to digest, send them on down. That means your stomach empties quickly, your blood sugar shoots up rather rapidly, and when your body calls out insulin to clear it out of the way, it can drop you rather quickly too and leave you feeling like you've run out of energy. If you have something in the mix that slows down stomach emptying, which includes protein, which usually is accompanied by fat, and fiber, then things get released more gradually. It's like a gentle rain versus a thunderstorm, where you can handle that carbohydrate coming through gradually, where a big dump of it sometimes is less able to be utilized. If you have any insulin resistance, which is prediabetes basically, where your body has trouble clearing blood sugars on a timely manner, the insulin lands on the cell and tells the cell that the sugar is there, but it takes some time for those steps inside of the cell to happen for it to send the transporters and bring in the sugar. And because of that, we tend to look for foods that as a whole by themselves tend to have either genetic differences that make them break down more slowly, or they're combined with protein or fiber, are things that make them be released more gradually. And so at that point, we look at things like glycemic index, but I don't think that is necessary for absolutely every patient to do. Our goal is just to keep you on an even keel and have those blood sugars be available for you. Women, I think, in particular, are really bad at letting other people help them. We're used to being the caregivers, and we tend to want to try to maintain everything that we've done before. And there's a period of adjustment that people go through, and often say it's one of the best lessons they learned from this whole experience was being able to let things go and to accept that things are good enough and to be able to delegate with some pretty concrete ideas for people. I actually find that that's very useful in preventing some of the internet advice that you can get otherwise. If you don't tell people how they can help you, they tend to come back with things from the internet that then just add to your stress level because you have to interpret them. And if you just ask them to come walk with you, in the case of Mr. James, that it would probably be really helpful for him if he is depressed or if he just needs someone there for some accountability, to have somebody coming over and helping him remember that it's time to go take that walk and to have company on that walk, or having somebody come help with cooking. And I recommend giving the person the recipe so that you know that you're going to like it when you get it back. That is something that would be helpful for you. And there's all kinds of websites now that you can organize some support around so that you don't get 3 meals in one night. And that might be helpful for you too. But more than that, you have to learn to pace yourself and to plan ahead of it, to spread out the meal preparation tasks and rest in between, and really look at saving the time, your time, for things you enjoy and that you do best. And if you need any help with this, if you're a real perfectionist, I love Brene Brown's work, and she has a book called The Gifts of Imperfection that you might find very interesting and enlightening about how we try to control things to keep things perfect. Okay. You can also simplify meal preparation, and there's nothing wrong with doing that. Crock pots are really very helpful. There's tons of great recipe books out there for that. The American Institute for Cancer Research, which is AICR.org, has some free pamphlets that they'll send you about, easy prep kind of meals for people who are living alone, and sometimes it's just less interesting to want to cook, and you certainly don't want to make it a big production. So those are things that might be useful for you to try to get. The 6 o'clock scramble is actually a site for working parents who are coming home and needing to prepare meals and needing something that's a little more organized in terms of grocery shopping lists and recipes. And that's something, it's a subscription, but sometimes people will do that for a month or two and just get a list of some rotations to do that might be useful for them. But you have to look at your energy somewhat like you look at your money. You have to withdraw carefully, and you have to deposit back into it. And some of those deposits actually might be things like exercise, because that improves your energy level, and it means taking time to drink and eat effectively so that you can be getting in what you need for that. When we look at integrative therapies, first, as I mentioned, people will come out of the woodwork to give you advice, and some of it will be appropriate and some of it will not. I think it's, as I said, another reason to give them something concrete to do for you. But otherwise, just tell them, certainly thank them for the concern, and tell them you want to go over that with your team and make sure that these are not going to interfere in any way with your treatment. And that's one of the reasons that blanket recommendations simply don't work. In general, I don't recommend multiple vitamins every day. I think unless your diet is extremely limited. But if you are going to supplement in that way, I prefer a multiple vitamin over a B complex, which sometimes people will be attracted to, thinking that it's an improvement for their fatigue. It's going to be more balanced. It's going to include all of those minerals that might be useful for you. And we typically go for a senior vitamin unless you're menstruating and having ongoing blood loss that you need the iron. So we're looking at a senior or a men's vitamin, no matter what your age is. Don't take the senior parts too seriously. I also really like vitamin D, and I think many of our patients are low. It's worth knowing where you are, where you're starting, because if your levels are low, which means below 32, certainly below 20 is considered deficient, that we are looking at things that are going to affect the strength of your muscles, and it even affects things like joint pain in people who are on aromatase inhibitors, the breast cancer patients, that if your vitamin D level is higher, you will have less of that getting in your way. We do see low levels of magnesium often with fatigue, and it's a pretty easy kind of thing to do because it'll correct relatively rapidly if you add in some more magnesium. The research was done with 200 milligrams taken 3 times a day, and the caution with that is milk of magnesia is a great treatment for constipation, but probably not such a great thing for if you already have diarrhea, that you're adding something that would cause kind of an osmotic pull into your GI tract and cause you to have more diarrhea. I tend to like the magnesium sources that end in ATE or that are what we call chelates or bound to a protein, again, as we talked about with the iron. Mag Plus Pro is one of those options, and it's available online. And the only other reason we'd say no magnesium is if your kidneys aren't able to clear any excess. So if you're having renal failure of any sort, we would stay away from it for that reason. Omega-3 fats may be helpful. I don't know that the research is as strong in this area. It may address some inflammation with the cytokine little messengers that are going around that can be creating some of this fatigue. But if you have any kind of bleeding risk, not enough platelets around, they're one of the things that can cause your platelets not to clump together so easily, so we would stay away from it for that reason. And there's some research saying that L-carnitine, which helps transport fat into the mitochondria, which is sort of the energy cycling area of your cell, has been shown to be helpful in cancer and doesn't seem to have a great deal of downside to it. So that's something you could pick up as well and try. I usually recommend that you don't try more than one thing at a time because then you don't know what's working, that you just put into place one thing at a time for yourself. Evening carbohydrates actually increase serotonin in our brains, and that can help with sleep. It can help with just mood and depression, all of those things. So that may be something you find if you've been staying away from carbohydrates, putting some of those back in the evening may be helpful for you. And certainly melatonin, which is produced by our brain when it's dark, and when we are exposed to light, as Barbara mentioned with the computer screens and things like that at night, it can put off sleep onset, and so this can certainly help with sleep. But it's very positive studies for fatigue and for some of the blood count issues and weight loss in advanced cancers. Unfortunately, most of the research was done by one group out of Italy, and they started with a dose that's very high at 20 milligrams. You can become normal with your levels with less than 1 milligram. So I usually encourage people to start with 1 and then build it up as they feel like it's helpful for them in taking the melatonin. Ginseng has been some recent trials saying that both American and Phoenix ginseng at about 2 grams decreased fatigue in some patients. I do recommend that you use the water extracted versions, not the methanol extracted versions, because those are considered estrogenic. So if there's anybody with tumors that estrogen is a concern, we would want to stay away from that. And it's always a great idea to have any drug interactions or concerns checked out with the pharmacist to make sure that other things you're on are not going to be a problem when you add that in. So we really look back and say, let's treat the cause of what this particular fatigue is coming from. If you think it's really depression and anxiety and that having some calming types of interventions are going to be helpful, antidepressants can be extremely helpful in just sort of resetting your outlook on things. We do not like St. John's wort because it interacts with so many different chemotherapies and treatments, and it actually causes the level of those drugs to drop and be potentially not effective for you. Exercise, absolutely wonderful treatment for depression and anxiety, and acupuncture has been attributed to some improvement in that as well. I would, reinforce what Barbara said about you need to address your pain, because if you're fighting pain all day long, you're going to be really tired, but you don't want to overstate yourself so much that you're sleeping and running into those issues. And we would like to treat any anemia. If you need a transfusion, you need a transfusion. If you need some iron, that's totally appropriate. There is a group of women after breast cancer that were being told that their continued fatigue was in their head, and that there was, they needed to get on with their life. And then when they actually looked at their blood levels, they found increased levels of some of those messengers, those pro-inflammatory kinds of proteins running around. And it's almost as if their immune activation that happened with their treatment in cancer never settled down. And so we're looking at, would anti-inflammatory strategies be useful in that group of people? So this is going to be somebody further along than Mr. James is, somebody way out in treatment who's still perplexed by why their fatigue is continuing for them, and might be something that they would want to look into at that point. And then finally, I have a screen that's both touch and it doesn't seem to want to be moving along. Okay. Finally, we'll go back to hydration, and focusing on a quart by noon and another by 5, and eating those regular meals and snacks that keep our blood sugars stable, and moving and outdoors if possible. I think Mr. James would probably, as I said, benefit from having somebody with him. You may feel more comfortable with moving in that setting, and certainly have the social interaction and engagement that would be useful as well. We probably need to talk to him about, what are your fluids? How are you cooking? Do you live alone? Do you need help with meal preparation? We have organizations I know in Denver, I'm sure they're everywhere, that can do meal delivery services that may be of use for that patient, and help him out with making it a little easier for him to eat. And certainly we want to help you somewhat adjust your expectations and realize you shouldn't be beating yourself up about this. It's a normal, unfortunately, part of the treatment process, and that we hope that by talking to your healthcare team, they can offer you more ideas for what might be useful in addressing it for you. I'm going to now turn this over to Laura and let her talk about her own personal experience with going through this herself.
Thank you, Colleen. I was diagnosed with stage 4 melanoma in March of 2012. I felt a lump on my neck and thought it was just a swollen lymph node and perhaps I might be getting sick. The surgeon I happened to be scrubbing for that day also felt my lump and advised me to get a needle aspiration during my lunch, and I did that. The pathologist stuck a hypodermic needle and aspirated cells from the swollen node and immediately looked at them under the microscope. They did this 3 times. After the 3rd pass, they came back into my room, and I knew from the look on their faces something was terribly wrong. That's when I heard the words, "You have cancer." My world went dark. I went from thinking I was just getting sick to undergoing my first operation 4 days later. I went from stage healthy 0, life is good, to stage 4 melanoma with that first operation. My specimen revealed my cancer had metastasized. I was now on the other side of the knife. I was the patient, not the scrub technician. From March of 2012 until August of 2013, no one told me I could survive this. I was exhausted, in a lot of pain, anxious, and depressed about what was happening to my body, my life, and if I'd even have a future. Many other operations and procedures ensued over the next year and a half, including 2 types of radiation therapy, external every day for a month and internal several times, as well as 2 different types of immunotherapy treatments, interleukin-2 and ipilimumab. The interleukin-2 treatment required 2 weeks in the ICU, 1 week in, 1 week out, 1 week back in. This treatment causes capillary leak, and I gained 40 to 45 pounds in 3 to 4 days. It was brutal to my body, the skin, and, of course, my mental outlook. My melanoma tumors kept spreading and growing. I was then referred to, met the criteria, and accepted into a phase 3 clinical trial of nivolumab. The FDA at that point had not approved the drug when my treatment began. I have been on this drug for over 2 years, treatments every 10 days, and will continue indefinitely until research determines otherwise. So I have hope, and that's turned my life around. The specific challenges I've faced with fatigue, I categorize as the good kind of fatigue and the bad kind of fatigue in 3 areas of my life: mental, physical, and social. The bad mental fatigue, just hearing the word "you have cancer" is devastating enough and takes a big toll on mental health and outlook on life. Coping with the diagnosis was challenging for me, and the first thing I wanted was information. All my providers advised me to stay off the Internet. They would tell me what I needed to know and answer my many questions. It's hard to stay out of the rabbit hole when you've been knocked off your feet into it. And, of course, my friends did all kinds of research and family, and it was too much. I just didn't want to hear it. The good mental fatigue, if you're going on the Internet for your own personal research, I recommend limiting the time you spend. This is so very taxing, and it takes a huge toll. There's a lot of good information out there, but a lot of misinformation. I tried to stay on top of my game. I followed through with medical insurance issues because when you become disabled and under 65, there's major loopholes, and I fell into a lot of them. I did some spring cleaning and got my affairs in order, and once I did this, I never had to look back. I let my family and friends know what my wishes were, and again, I never have to look back. Mentally, I started reading inspirational books instead of self-help. I'm learning how to meditate and do the mindful or the guided imagery. Sorry about that. I've programmed my phone to remind me at 8:30 every morning until it dies, my phone dies, to be grateful. So at 8:30, I get a little bling, and I look down and my phone says be grateful, and I try to think of one thing every day to begin my day and be grateful for, and it changes every day. My physical fatigue, the bad fatigue, is just the recovery and healing process that my body had to go through. It's been hard for me to be patient and give healing the time it requires. My body has to adjust to every new pill, new infusion, radiation, operations, and procedures. My fatigue was huge, not to mention the side effects from these different treatment modalities. For me, they've included rashes, pain, sleeplessness, anxiety, depression, weight gain, skin changes, and nausea. After my treatments, I'm extremely thirsty, and I drink at least a gallon or more of water a day. And I always try to carry water with me wherever I go. The good physical fatigue, I try to do something, some exercise or physical activity every day. I was a gym rat before all this began, 1 to 2 hours in the gym. And Rhea mentioned in the introduction what I'd like to do. And all of a sudden I wasn't able to do that. And when I exercise, my endorphins get activated, and I know I don't need as much sleep. My appetite improves, as well as my mental outlook. So I would advise doing something every day, and it's not about an insanity workout or PX90. It's just walking's a good start, and maybe lifting light weights. And in terms of nutrition, it's been hard for me. I have a loss of appetite, and I'm just trying to do better with things I hadn't incorporated in my diet, like filtered water, drinking Ensure, and I bought a Vitamix to make supercharged kale shakes. So vegetables and fruits are left over. They go in the Vitamix with yogurt and flaxseed and usually coconut water. So physically, I'm getting stronger because I'm trying to do these things. The social fatigue, the bad social fatigue for me was I experienced a lot of attention the first year. My operating room family, friends visited me from 5 in the morning up until midnight every day. I was in the hospital, and I was exhausted and quite often felt like I needed to entertain or be the hostess. I think it's because everyone was in disbelief at my diagnosis and grieving over a potential loss of a friend and a coworker, mother and sister. At first, there were a lot of meals delivered, cards and calls and visits, to name a few. Then after a while, when they realized I wasn't dying, I kept bouncing back. Gradually and slowly, this tapered off. People move on with their lives, and especially if you don't look sick. And then they wonder why you can't go back to work. Why can't we do the things we used to do? And I had to become my own police dog and learn how to say no or no thank you. I'm tired now and need to rest. Well-wishers really, I think, don't know what it's like to have cancer, and they almost always overstay the visit. So I suggest limiting the visitation time while you're recovering because rest is so important. The good social fatigue, my philosophy is I've tried to put my pain and suffering to good use, and I sure don't want to waste it. So I've tried to get involved by volunteering, attending as many workshops as I can, not always cancer-related. I'm going to attend a retreat next month, and I'm excited about that. I found a mentor. Mine was through Ammerman Angels. She lives in Ohio, and I'm in California. We talk on the phone and email each other, but through this connection, she was able to get me to join, this is going to sound funny, a secret Facebook support group website. And this has led me to meeting other melanoma survivors in the state, in the Bay Area, and it's been great. And another thing I've tried to, I have raised money with many supporters for my particular cancer, and I've connected and I'm very involved in 3 websites, which has been good, very, very good. Sometimes I find that my closest friends and coworkers or former coworkers and family, they say the darndest things, and it's usually when I'm vulnerable and sensitive and I feel like I'm being judged and attacked, and I really am not. I know they mean well, so I've had to learn how to be more compassionate towards them. They've been strong for me, encouraged me, listened to me when I've been in the rabbit hole, and a very specific experience with my daughter led me to a greater awareness of how my actions and thoughts were affecting others around me. We were driving back from Texas to Flagstaff, and we had an argument, had to pull over in New Mexico, and it was over me not being able to leave her a phone message because her mailbox was full. I said, just delete the old messages, and she told me she'd saved every message since I had first received my diagnosis, because all I ever did was talk about dying, or if I'm still around, or if I'm still alive, those kind of comments. And she wanted to hang on to my voice in the event I did pass. And I didn't know how much a person could be loved, and that's the moment I stopped talking about death and dying. I started making plans and rephrase what I say, and that has given me a more positive outlook because the people who love me also go through their own grief, but they don't show it because they're being strong for me. And at first I thought cancer was all about me. Everything's centered around me, and it's false. Cancer affects everyone. The ways I have coped, at first I did everything possible. Support groups, which when I was first diagnosed, those support groups I found really discouraging and depressing, because the ones I was involved with, they talked about what they used to do, how they can't do this anymore, and I needed to be around people who were still doing those things. And I know I was in denial, but I needed human contact, and that wasn't working for me. But eventually I got back into it, and now very attuned to the virtual, website contacts. The ways I've coped is the busier I keep myself, which goes against all fatigue red flags, but the busier I keep myself, the stronger I become, the less focused I am on myself, and I try to busy myself doing things for others. I participated in 3 AIM walks, one which led me to Oregon Health Sciences, and a very special SCAR project that I participated in. I've tried to learn new things, taiko drumming lessons, and learning how to play mahjong, which led to another group outside of my regular friends, and just connecting with myself, learning how to meditate so I can find inner peace. I'd rather be a survivor and a warrior, which apparently I am, than a victim of cancer. I always say yes when someone offers to help me or offers to drive me to an appointment. It's accommodating and makes it easier for me, but I realize this is their way of dealing with my disease, and maybe letting them help me is their way of coping with it. And I realize they're just as devastated by this as I am. I can't imagine, and haven't, thank goodness, I can't imagine losing a friend or having to watch them wither away. So how I cope is I just say yes and never, ever give up. To quote the 2 books I really recommend, one is by Dr. Kelly Turner called Radical Remission. I went to a workshop. It's very positive and inspiring. And one of her 9 reasons for radical remission, she traveled the world, was have a strong reason for living. And the other book is by Mark Nepo, The Book of Awakening. It's kind of poetry and then his impression and meditation on a daily basis. So right after I'm grateful at 8:30, I read whatever the lesson is for today. And he's a cancer survivor and has been through a lot. And it's just very uplifting and inspirational reading. So I talk kind of fast. I don't know if I'm out of time. But I think I should probably turn the presentation back to Rhea, if that's okay.
Yep. Thank you, Laura.
Okay.
So at this time, I'd like to turn the presentation over to the audience. If you have any questions, please feel free to submit them in the Q&A box. And give us a couple seconds as we poll for some questions. So our first question is, it says here, Barb, if you'd like to, I think this would be directed towards you, but it says, after 15 years of cancer, off and on, how can you press through fatigue even when society doesn't understand? I think this is the issue that, there is fatigue that happens even years off of a cancer diagnosis. Yes. And you don't have to actively be in treatment. So,
gosh, that's a good question. I think that there still is so much lack of awareness of the level of fatigue experienced by people who currently have cancer and have been treated for cancer in the past. I guess it's all about teaching people. I honestly don't know what else to say. There are some people who never return to where they were before, or people, especially if they continue on treatment, that will continue to have fatigue. I think it's finding people who understand and getting them to support you. That's not a great answer, but it's very challenging.
Yep, definitely. So do you have, we have another question here for you, Barb. How can I get my physician to take my fatigue seriously? I know you had provided some example statements at the beginning of your presentation. If you would go over those that you had presented earlier, and then if you have anything else to add.
Well, I think that's really a two-part issue. I think that, unfortunately, there still are way too many healthcare providers who don't appreciate the fact that fatigue is a real issue. I think that there's information you can find from some of the organizations like the National Coalition of Cancer Networks and even the American Society of Clinical Oncology, where they have come out with information about fatigue that could be shared with the physician. But I think it really is talking about comparing how you are currently with how you were in the past, and how much less you're able to do than we're able to do before, and being very descriptive and kind of pushing to make sure that any evaluation, like making sure that blood counts are done, making sure that that you have an opportunity to talk to someone who can fully evaluate. And I'm a nurse, so I guess I'm always a proponent also of, is there a nurse that you can talk to who could do some of the evaluation? Because a lot of the stuff you can do is not stuff that has to be prescribed by a physician. Is there a social worker or a physical therapist who could help work with you to help improve your functional level? Great.
So we have another question here. I think it goes in hand with the first question that we received. It says, does fatigue last the rest of your life, or is it possible to overcome this kind of fatigue?
It absolutely is possible to overcome it for some people, depending on treatment. I think that a lot of the cases of people who have continued with fatigue long-term have had pretty intensive treatment to start out with. And some of it may be, kind of revising your expectations. I know my sister has had a lot of fatigue and will never be able to function at the same level as she was before. But you know what? Honestly, she doesn't want to. So some of it's revising your expectations. But if you're doing the things, like if you're getting the physical activity, if you're following dietary recommendations, you're taking care of yourself to make sure that you're dealing with the stress and reducing your stress as you best can, those are all things that are going to go a long way toward relieving fatigue. Medication can help, but it really is not the answer with fatigue for most people.
Great. And then
I'm sorry, let me just jump in and say one more thing. So late fatigue can still resolve.
Great. So our last question is, I think it's more of a clarification question. So it says, I'm a 51-year-old with multiple myeloma, 1 year on treatment, stem cell transplant, and am in remission, currently starting maintenance chemo. Throughout most days, I have about 3 to 5 hours of energy, then I'm done. Is that fatigue or is that the cancer?
That's fatigue. After having that much chemotherapy, and the stem cell transplant, it takes a while. It will take quite a while to have your energy recur, but it should gradually come back. Just you have to take care of yourself. And it can take months, and it's very difficult to be patient for that long, but people do recover even after months.
Great, thank you. So that is all the time that we have today, but I did want to just take a moment to talk about our grassroots movement. which basically gives patients the opportunity to get up-to-date information on key issues that are important to patients with cancer and their loved ones. Also to be part of a network that interacts with Capitol Hill, and to have your voice heard along with other voices of patients with cancer and their loved ones. So if you'd like more information on this, or if you'd like to join this movement, you can visit the CSC website. Here are just some additional resources if you'd like some more information. And at this time, I would basically just like to thank everyone who attended and participated and shared your questions with us. We greatly appreciate it. If you'd like more detailed information, again, please feel free to visit the Cancer Support Community website or call our toll-free helpline. We would like to thank our wonderful speakers, Barbara, Colleen, and Laura, for contributing your time and for sharing this important information with us. CSC would also like to thank our program supporters, Amgen, Astellas, Lilly, and Tesaro. You'll now be redirected to our post-webinar survey. It is a brief survey, and we appreciate your feedback. Have a great night.